The health officials in South Korea have instructed crematories to burn more bodies per day and funeral homes to add more refrigerators to store the dead as families struggle with funeral arrangements amid a rise in COVID-19 deaths. The country has been dealing with a massive coronavirus outbreak driven by the fast-moving Omicron variant, which has compromised a once robust pandemic response and is driving up hospitalizations and fatalities. Officials have already allowed 60 crematories across country to burn for longer hours starting last week, which raised their combined capacity from around 1,000 to 1,400 cremations per day. But that hasn't been enough to meaningfully ease the backlog of bodies waiting to be cremated in the densely populated Seoul metropolitan area, which is home to half of South Korea's 52 million people and the center of its COVID-19 outbreak. The backlog has also trickled down to funeral homes at hospitals and other facilities, where the families have struggled to make funeral arrangements because of the longer wait for cremations. Senior Health Ministry official Sun said during a briefing that officials will instruct regional crematories to increase furnace operations from 5 times to 7 times a day, which would match the levels of crematories in the greater capital area. The country's 1,136 funeral homes at hospitals and other facilities are currently capable of housing some 8,700 bodies, and officials will ask them to increase their capacity. There have been regional differences in COVID-19 deaths because of various factors such as the size of the elderly population in each community. And there's also a difference in the capacity of cremations each region can handle, officials said. The country reported 384 new COVID-19 deaths on 22nd March, the 6th straight day of over 300 deaths, including a record of 429 deaths on 17th March. The number of virus patients in serious or critical conditions were at 1,104. Nearly 70% of the intensive care units designated for COVID-19 treatment were occupied. Health workers diagnosed 353,980 new infections in the latest 24 hours, down from single-day high of over 6,21,000 on 17th March. Jeong, Commissioner of the Korea Disease Control and Prevention Agency, said there is also a possibility that the spread prolongs because of a highly transmissible Omicron subvariant known as BA2. South Korea has a much lower rate of COVID-19 deaths in relation to population size than the United States or many European nations, which officials attribute to high vaccination rates. But some experts say the country may be on the verge of dangerous hospital surge considering weeks-long intervals between infections, hospitalizations and deaths. Kim, an official at a crematory run by the Seoul city government, said the facility has been operating its furnaces until 10 p.m. while cremating 131 bodies per day, up from its normal daily limit of 91. But families are still waiting around 5 days to reserve, she said. Omicron has forced South Korea to abandon a stringent COVID-19 response based on mass laboratory tests, aggressive contact tracing, and quarantines to focus limited medical resources on priority groups, including people 60 and older and those with pre-existing medical conditions. Nearly 2 million virus carriers with mild or moderate symptoms have been asked to isolate at home to save hospital space. Citing the pandemic's growing toll on service sector businesses, the government has eased social distancing rules in recent weeks, allowing for longer indoor dining hours and larger social gatherings. But some experts say officials are putting the hospital system at risk by putting the economic concerns before the epidemiological ones.